Welcome
Welcome
to
to
the
the
Daily
Daily
Egg.
Egg.
So, today we're going to be talking about fertility testing. And since our last video, which we talked about the sperm donor selection, Ashley has undergone a lot of different testing. And we are going through a fertility clinic here. And so, typically, this testing is really to diagnose infertility, but we still have to go through all of the same tests for insurance purposes.
Yes. So I'll get into the process, and I have some notes, so I might look down just to kind of refresh my memory on everything. But so after the first visit, the first virtual visit that we had with our doctor, she ordered a bunch of different testing to get a baseline of where my fertility was. And the testing is based on where you are in your cycle so that they can test different hormone levels that are related to your fertility, as well as do some egg counts that are, based off of where you are in your cycle. So after that visit, I had to wait till like day one of my next cycle to call to schedule a series of tests. And so on day 3 of my cycle, I had to get blood work done. And then day 5, in between, sometime between day 5 through 12, I had to get both vaginal ultrasound as well as, I don't know how to pronounce it. It's the name that you'll often hear is called an HSG. And I'll kind of go through what each of those were and what they were looking at. So if you are someone who has to get a bunch of fertility testing done, or if you're not going through a clinic and want to try and kind of want to have an idea of how to get a baseline for where you are, it's a good place to start. And we both have to do it.
Mhm.
Um, I started first because I'm planning to go first, but Danny will also undergo it at some point as well. So, let's see what I said here.
So, why did you have to do the testing on day 3?
Yes. So day 3, it typically depends on your cycle, like how long it is. But on that day 3, your reproductive hormones are sort of at a baseline. So it's a good indication of where they are. If you think about your cycle, like, it's just a series of your estrogen rising up until ovulation before it declines. So before they're like looking at like before ovulation to see like where those baseline hormone levels are at. In your cycle. So some hormones that have to be tested on day 3 to get the most meaningful results are estradiol, FSH, and LH. If you haven't heard of those before. So FSH, what does it do? It's the follicle stimulating hormone, and it helps grow the follicles. So the start of your cycle, after you go through your menses, your body is selecting different follicles, and one of those follicles will mature into an egg that's released during ovulation. So that's what that hormone does, is it helps to stimulate the different follicles. And then estradiol is a hormone that kickstarts the body's process into ovulation. And then LH is called the luteinizing hormone, and it triggers ovulation. So, oftentimes, if you're already like pretty far along in your planning of having a child and you're tracking your cycle, LH is like the signal. It like helps signal to your body like we have one egg that's ready to mature and get released for ovulation, and you tend to track that to see where you are in ovulation. But they're looking at just sort of the baseline levels of those as well. And then what's normal really depends on your age and some other factors. So they're really just looking for sort of that, like, I guess the results really depend on like where you are in your age.
Mhm.
Um, and then the blood test, they tested me for about 21 different things. They took about 13 vials of blood. So it was a lot of blood. And it also included genetic testing. So because we're using our donor also had genetic testing, so they could understand. We talked about this a lot in our last video. So that was where I got my genetic testing, is through that blood test. But I won't go through all of the things, but they were kind of in like a few different buckets. So you'll hear AMH a lot, or the anti-Müllerian hormone, and it's a really good indication of like your how many eggs you have, basically, or like how fertile you are. Like some people use it for that number. I think there's a lot of other factors that go into fertility, but it's really a good it's an indicator of your ovarian reserve, and directly related to how many eggs you have in your ovaries. Then they also did like testing for HIV, hepatitis B, measles, syphilis, and then CMV, which I don't know if we want to talk about that now or.
Yeah.
But essentially, like STIs. Then I just had general blood work, and then they were also looking at my thyroids and how they were functioning. It was really hard to get that many vials of blood taken on day 3 of my cycle, so I was pretty exhausted.
That's a lot of
It's
blood.
a lot of blood, and I didn't know they were taking that
Yeah.
much blood. Even though I knew they were testing for a lot of different things, I guess I just didn't really think of like how many vials of blood that would translate into.
Well, you're already bleeding.
Yeah. Yeah. So I definitely recommend making sure you're well hydrated and
Hmm.
you've had a snack before and that you plan to continue drinking water throughout the day and continue. I had some little candies that I just happened to have in my um, pocket because I felt really like I could just feel the blood rushing from my face and I just felt kind of a little faint. So, but everyone was really nice. So, and then so that's that. And then for my at least for our for fertility clinic, I got the results right away. As soon as they were available, they came in. So they came in either like the same day or over the course of multiple days. You just get the numbers. So we did have to wait until just recently to meet with our doctor to kind of go over what that means for us and what that means for like whatever plan that we're hoping to take. But the results come back pretty immediately.
Hmm.
And then, did you have something to say?
Go ahead.
So and then cycle 5 through 12. So all I got on day 1 of my cycle, I'm scheduling all of these and then I have them. So I get the HSG and the vaginal ultrasound. So the HSG is like an opportunity for them to see the shape of your uterus, to see if there's any blockages, to see if there's any like scarring. And again, if you kind of think of it as like we're going to a fertility clinic, right? So they're trying to diagnose all the reasons you might not be able to have kids if you're actively trying, which we don't have the ability to actively try. Uh,
Well, we have the ability, but it's not going to produce any
yeah, like we couldn't
results.
go home and just try. We can't try. We can't try regularly for months. Like there's no way for us to know if we're fertile based off of trying. So this test is really meant they fill your uterine cavity with a dye and then they put you under like an x-ray machine in order to see how the dye flows and to see the shape of your uterus and to see the shape of your fallopian tubes and to see if there's any sort of issues. I did have a small blockage in my right fallopian tube, and that was able to be cleared out. So, but there was like a light like a slight blockage there. Um, that test often is described as like extremely, I feel like there's polarizing things. Some people say it's like the most painful test that you'll ever get. And then some people say it was like not that big of a deal. And when I went in, like I would say again, the staff were incredible. They were so kind. And the person who was doing the exam like talked me through everything and talked me through what to expect. But they did start off with like, oh, it won't really be that bad. And I think the consensus with people who tend to have a pretty painful experience is that they often do have a blockage. Like, and I think it's like kind of that filling up of the liquid that causes a lot of pressure and pain. So it was pretty painful. And I like it's hard to describe the type of pain. Like at one point it kind of felt like a period cramp, but then when it hit that blockage, it was just like I just immediately felt I had to throw up. It was really difficult and painful. It's very quick, so it's not like in a really long time. And then once the dye starts to flow, then it's basically over. I would say I was still uncomfortable for a few days afterwards. So like when I went home, the dye does continue to leak out of you and it's kind of sticky. And I had some cramping, some spotting, and I just felt like really tired and a little bloated. And I just felt like that for like a few days. Um, so I gotta sip my change. So then right after that, I had the vaginal ultrasound, and in that they were doing a few things. So one was a mock transfer, so they do like a mock IUI just to see if there's any difficulties in inserting the catheter and just to see how you sort of tolerate the procedure. So that happened. Then they also count the follicles that are developing in each fallopian tube to see where you are with that. And they kind of like look around for different things. Like I had a small cyst and I had some fibroids. So they just, they're just like looking around in there. I think the biggest thing is like doing that follicle scan to see like how many, like the potential of eggs, and to kind of get an indication of your ovarian reserve. I would say that was nothing compared to the HSG. It was very simple. They gave me like a nice warm heating pad because they knew I had just come from the HSG, and it was also very quick. And they I could see what they were seeing. They talked to me through everything, and I would say that that was pretty simple. So yeah, I think that was like kind of like the overview of all of the different tests. And again, with like each of those tests, I got the results back almost immediately, but you don't get like an analysis of the results. You really just get like literally like what the results were. And so it was really helpful. We just had the visit with a doctor to kind of go over what those results meant for me personally in terms of like our plan
Mm-hmm.
and like what it says about my ovarian reserve and my fertility to the extent that they can understand that, and then what it means for like what our next steps are.
Mm-hmm.
So there were like a couple tests. So
Yeah.
anything.
And I feel like there was not really any surprises on our appointment. We had done like a lot of research to interpret the results. And so by the time we had the appointment today, which has been several weeks
Yeah.
since the testing, we kind of knew what to expect. And so yeah, I think like the doctor and us are on the same page in terms of how we're going to proceed. And um, I guess the other thing is the genetic testing. Did we talk about that
I
already?
guess we kind of talked about it in the sperm donor, but what
Yeah.
else?
Well, I don't remember at what point we were at that video a few weeks ago, but essentially, Ashley needs to have additional testing because our first donor was denied. I think that's where we ended, that our first donor was denied, and we thought we had to go back. But really, when we asked more follow up questions, we realized that we could still potentially use the donor, but Ashley just has to get more genetic testing because there was a couple of conditions that he was a carrier for that it's not that she was positive or negative for, but she just wasn't tested.
Mm-hmm.
And so I guess that's like a word of advice that it's like, yeah, just keep asking questions and say like, is this a definitive answer that you're giving me, or is there
Yeah,
like
yeah.
more that we can do to explore this?
Yeah.
Because that was kind of a roller coaster of like, oh, we have the perfect sperm donor, and then oh, we can't use them, and then oh, maybe we can. And now we're waiting for the
Yeah.
final result, but it seems like it's possible. We also, in the meantime, met with a genetic counselor, which was really interesting.
Yeah.
I feel like it gave us a overview of like genetics 101 that we learned in like high school science classes.
Yeah.
um, but then they went into like more specifics and details about the specific genetic conditions that we were looking at, and like how they, how genes are repeated and how they would pass on to our lineage, and like what risk it basically presents in our
Mm-hmm.
ancestry. And then it's kind of up to us to figure out like, is that a risk we're willing to take or not.
Mm-hmm.
And I think with all of this process, we're also keeping in mind that if we were a straight couple that was like conceiving just through sex, then we wouldn't actually have any of this testing done.
Yeah.
Most likely.
Right.
And so, we're kind of like taking all of this with a grain of salt and just making the best decisions that we can for ourselves.
Yeah, it's really wild to think there's so many more people involved in our process. We,
Mm-hmm.
like it's not just us. Like it's a donor, it's our doctors, it's the fertility clinic, it's
Mm-hmm. The
the
sperm
the
bank.
sperm bank. And so
Yeah.
every step of the way we have to get approval. We could
Mm-hmm.
really like a donor, but there could be a factor that means like we can't use them, and it's like we just can't. And so it is really interesting, and things that we wouldn't think about if we were just like kind
Mm-hmm.
of out um, doing it, I guess. So it is really interesting, and I
Yeah.
think it's hard. It makes it hard to plan a little bit. I
Mm-hmm.
think you just have to be very flexible and very
Mm-hmm.
open, and have really,
Patient.
yeah, very patient.
Not my strong suit.
And just communicate, ask
Yeah.
asks a lot of questions.
Mhm.
Um,
I think that's hard for me too because our doctor, I mean, you can tell she's extremely intelligent. She knows what she's doing, but she talks so fast and she's just I just feel rushed. She'll explain everything like super fast like this, but like with a lot of scientific detail. And then she's like, "So any questions?" And I'm like, "Yeah, let me catch up my brain to what you just said first." But it's been helpful for us to sit down a few minutes before every meeting and come up with a list of questions. And then one of my tasks, I guess, I don't even know if this was discussed, but my task has become note taking. And so we
yeah.
keep like one notebook full of all the information. So we write down our questions and we write down the answers and we write down everything that was discussed in the meetings.
Yeah. I really like her, but she is just
Yeah.
talk fast.
Yeah.
And I think what's helpful is that we also have all these other resources. Like we're
Mhm.
meeting more couples, queer
Mhm.
couples who have conceived. So we're getting a lot of like having opportunity to talk like with them about their experience or terms we just found out about,
Mhm.
and like a lot of research online. So I think if we didn't have that, it would almost feel like whoa, whoa, whoa. But I think this is a process I feel like both of us own.
Mhm.
So it like, I think it makes a little less overwhelming
Mhm.
to kind of have her at the speed that she is.
Yeah. And one of the resources that I don't think we were that involved in just a few weeks ago, but something that we kind of came across from a few different angles is this virtual community called Pregnant Together. And it's run by a person named Maria Goodman, who's the author of Baby Making for Everybody.
Yeah.
um, and we have like joined their virtual community, and there's a bunch of different support groups. So I joined one for non-birthing parents. There's like different kind of I don't know what you call them, kind of like subgroups too. So
Yeah.
there's like a trying to conceive group where people can post about their experiences or commiserate on things or give resources or share helpful information. And then Maria also kind of started a chat with people who are in the Massachusetts area or the
Mhm.
Boston area. And then separately, someone reached out to me and said, "Oh, we live in the same neighborhood as you." And so we just met up with them,
That
another
is
queer
lovely.
couple, yeah, who is trying to conceive. And they also know another queer couple in our same neighborhood who's also trying to conceive. And so I feel like, we just keep taking like one step and meeting people. And then it's gradually, I think, expanding our circle, which is
Yeah.
so helpful to have people who really get it and who are yeah, on a similar journey. Even if we have different ways of getting pregnant, it's still really helpful.
Yeah, absolutely.
This was really the first time in this journey so far of the like kind of the physical burden of all of this falling on Ashley, which is obviously going to happen a lot during pregnancy. But for me, it was really like going back to kind of talking about the testing process and like what Ashley went through. I think for me, it really was the first time I reflected on what my role is going to be like as a non birthing parent. And like we kind of mentioned before, that could be its own video because I think it's so complex. But I think I'm really just kind of thinking about that now. And so during the testing process, like I had asked Ashley about, what might you want after the testing? And it's just sometimes hard to plan because you really don't know how you're going to feel. But we did, come up with like a couple of aftercare plans. And so I um, met Ashley at the office and, like, kind of made sure she was okay right before the procedure. And then afterwards, ordered an Uber home, got home, dropped her off, made sure she had a heating pad, was like, had everything she needed, got nice and comfy. And then I went out to run all my little errands, which I have some funny videos and pictures of. Um, but yeah, I got us dinner and some treats, and then the treats happened to also be next to a baby store, so I might have gotten a onesie that was very cute. And really, like my role there was just to kind of provide comfort and care. But I think yeah, as we go, I think we'll have a lot more conversations about what that looks like in terms of you being pregnant, but like what can I provide
Yeah.
also so that
Yeah.
it feels like we're doing this together.
Yeah, it was very helpful to, yeah, we didn't know what to expect with the HSG
Hmm.
and also all the other tests I had that day. So it was really nice to like know that Danny was there to like take care of me, get me
Which
my
I
little
think is hard
treats.
for you to
Yeah.
be taken care of. Allow
Yeah.
yourself to be cared for.
Yeah, it was really nice. But yeah, I guess no one prepares you or no one, there's not a lot of models for like what for two women having a baby and like one of them isn't pregnant,
Hmm.
and like
Hmm.
what is, excuse me, the role of that person. And I'll experience it too of just like I don't know, I feel like it's natural. I can imagine that I'd want to be like, I don't know, making, just doing stuff,
Hmm.
like kind of in there. And it's like you're kind of like you're not the pregnant person.
Yeah, I mean, it felt a little bit powerless to me,
Yeah.
and I'm not really, yeah, used to feeling like that in this context when it comes to like gynecology things, like having
Yeah.
procedures done. Like it's like I'm usually the one doing it, and
Right.
so yeah, it was just kind of a weird reversal of roles for
Yeah.
me.
Definitely.
Yeah.
Definitely. Um, yeah, I would say like I guess my tips from those tests. So again, it's in the context of if you're using a fertility clinic and I think keeping in mind that the goal is to like get people pregnant who've been experiencing challenges in getting pregnant. And for queer folk who may not know like what their experience, like who may not know what their fertility is or, at the point in which they're trying, I think you do have the right to maybe like ask more questions about why you're getting certain tests done
Hmm.
or if you can have just modifications made. Like
Hmm.
after Danny saw what me having to get 13 vials of blood, asked the
Hmm.
doctor, like, can I split it up? Because that's a lot
Hmm.
of blood.
And
And
the
she's,
doctor said absolutely.
yeah,
So I'm glad
totally.
I asked. And
Yeah.
also, even HSG, when I get to that point, I might ask, like, is this necessary? Does insurance require it? Like, what are the risks and benefits of getting this procedure? Because I mean, honestly, watching you go through it, it just seemed incredibly painful. And if I don't have to do it, I would personally choose not to.
Yeah. I also had to go on antibiotics because there's a
Hmm.
risk of infection, which made me really nauseous. Like, if you
Hmm.
don't have to put your body through that, like, ask,
Yeah.
or do your own research. I guess just don't feel like you have to just follow along.
Hmm.
Um,
Because they say it so matter of factly and so like not forcefully but with such authority that like my impulse is just to like trust them.
yeah.
But then I also remember that like I'm an adult, I can
Yeah.
ask questions and have some decision making. So
Yeah, definitely. So yeah, I think just, also for those tests to wear comfortable clothes, take off from work, plan to take off from work the next few days. Um, yeah, I think just take care of yourself throughout all of that. And you may have your own experiences around it is feels very invasive. Like I had
mm-hmm.
5 people like up in there, that I've never met. Well, lovely people, but I've never met them. And it was a lot. So I just felt like I think that was the emotional tired feeling that I
Mm-hmm.
felt afterwards of just like, damn, that was kind of a lot. And it's really just
Mm-hmm.
the beginning of just like having your body out there.
Mm-hmm.
Or people seeing you in really vulnerable positions, like being in pain or learning really difficult news, or
Mm-hmm.
just like, I think it's a lot to experience with folks.
Mm-hmm.
But yeah, so we did meet with the doctor. What I appreciate about like the follow up, I mean, she was very quick and kind of went through it. Um, but she made a point. She's like, I want to make this like cost effective for you,
Mm-hmm.
and which I really appreciate. Because if you are familiar with IUI, like you can do it unmedicated or medicated, and the medications can be really costly. And I was very firm that I wanted to do my at least my first one unmedicated because I know my cycle and I feel really comfortable with timing. And
Mm-hmm.
a lot of what medication does is like basically like figure out the timing for you and increase your chances there. But there can be other risks. Obviously, you're on hormone; it can increase the risk of multiples. Like there's lots of different things that can happen. So I really appreciate that she was like, let me save you some money. We also asked, like, because of my age, like I do have a declining ovarian reserve. But for insurance purposes, we have to at least try 6 times. So Danny
Mhm.
asked, like, well, why don't we just go to IVF?
Yeah. Like my question was, uh, I know that the insurance covers IVF after 6 IUIs, but would it be more cost efficient to actually just pay out of pocket for a round or two of IVF? And she basically said, probably not. And because, I mean, we really don't know. We could get pregnant with IUIs really early on, or on kind of on the other end of the extreme is we could go through 6 IUIs and then still have to go through several rounds of IVF. And so if we were to start with IVF and go through several rounds, that would be like really astronomical.
Yeah, definitely.
So yeah, so I think that we're all on the same page, and the point is that yeah, we're moving forward in so far the way that we had planned.
Yeah, which is great and really hoping for the best. So I think in our next videos, so we did talk about a little bit about our post-visit checkup. There's not really
Mhm.
much else to share there, but I can talk to you about what we've spent so far, and whatever else is sort of next
Mhm.
for us.
Mhm.
And yeah, I think that's pretty much it.
Mhm.
Do you have anything else?
Nope.
Okay. So thanks for joining us.
All right.
What's this? What do we say? And
Until
until
the
the
baby
baby
comes.
comes.